honoured to be able to welcome to the stage Clare Blackwell, who is one of our junior doctors from Poole Hospital. Can we have a big round of applause? Let's show our support. Thanks very much. It's a pleasure to be here today, and thank you to Sheila for inviting me to speak. I'm really proud to march with you all today in defence of our NHS. I've been a junior doctor for 6 years now, and part of the reason that I became a doctor was to work for the NHS. So I didn't become a doctor to work for Richard Branson, so I'm a little bit disappointed really with the way that things are going, so thank you. I remain fully committed to an NHS that is based on its founding principles, which is one of a universal health service for everybody according to their need, not to what they can pay. And as a junior doctor, thank you, we took part in industrial action this year. And this was the first industrial action by junior doctors in the last 40 years. And I know that many of you supported us and came and stood with us in solidarity on the picket line. And I'd like to say thanks again to anybody that did come and support us. It was much appreciated. Thank you. We did manage to force some concessions from the government, but we are unfortunately left with a contract that disproportionately discriminates against women and disabled doctors, which is obviously unacceptable. And we're left with a contract that doesn't recognise weekends as a time that should be financially rewarded well for doctors. And the big danger with that is that a tax on our pay are going to lead to a tax on pay and conditions for staff across the whole NHS. And I'm concerned about attacks that are going to come for enhancements for nursing staff, for physios, for all of our allied health professionals. And we can't work on our own, we work with all of our colleagues all together. So that is one of our biggest concerns about the contract. And I really think that the reason that we failed is that our union, the BMA, didn't build united action with the other healthcare unions. I really feel that that is what we would have needed to win our industrial dispute. Anyway, the other thing I'd like to say, because this is the People's Assembly, and they have a message of agenda against austerity, that the attacks that are on the NHS are not happening in a vacuum. They're attacks that are happening across the public sector, and attacks that are happening on social care are having a massive impact on us in the NHS. And we see that every day. And the attacks on ordinary working people of austerity are having a massive impact on the healthcare of our nation. We're seeing more and more people in crisis with their mental health. We're seeing more and more children who are malnourished that are relying on food banks. And so what I really want to say is that the fight for our NHS is also part of a fight for a fairer society, a society that puts the needs of the many above the wants of a few. So thank you, and I hope you all have a good rest of the day. Thank you.